Assalamu alaikum and welcome to the Dr. UUT channel. In this video we will talk about the antiarrhythmics class 1 and class 3 drugs. This lecture is available in Urdu, so now we'll commence the lecture in English. Well, let's commence the lecture in English. Class 1 will block the sodium channels and class 3 will block the potassium channels. So these are actually called as sodium channel blockers and potassium channel blockers. So if these block the sodium and potassium channels, in the myocytes, the depolarization is caused by the sodium channels and the repolarization is caused by the potassium channels. If we block them, what will happen? A kind of delay will be observed. Delayed depolarization and delayed repolarization. So when there is delayed depolarization and repolarization, then what will happen? Then there will be a kind of modified action potential. So generally, a cell is receiving 1, 2, 3, 4 and a very quick repolarizations. But when we give these drugs or these medications to the patient, what will happen? That there will be a delayed depolarization, repolarization. Then what will happen? Then there will be a kind of signals movement towards the myocytes. But now this cell has undergone the prolonged depolarization and prolonged repolarization. So now it will take time to accept the next signal. For that sake, we can see that these drugs are actually delaying the depolarization and delaying the repolarization in order to delay the quick contraction and quick relaxation of the myocytes or of the heart. That's it. So they are actually helping us to reduce the arrhythmicity and to bring the heart into a specific rhythm or rhythmicity. So coming to the point, how the sodium channels blockers are doing their action and how the potassium channels are doing their action. Sodium channel blockers are further composed of 1A, 1B and 1C. Why is such kind of division observed? The reason is that sodium channel blockers are actually composed of two gates, M gate and H gate. Normally both are closed. In case of active state, sodium will move in, the M gate will open along with the H gate, they will also open and the sodium will move in. In case of inactive condition or state, the influx of sodium is blocked. Why? Because the H gate is closed now. So M gate are open as like before they were open in the active state. And 1A drugs are actually acting on these two. And you can say they're acting on active and inactive gates. 1B drugs are just different from the 1A in a sense that 1B drugs will combine with these two gates but for a very short period of time. Though 1B drugs are also binding to the active and inactive gates, the same gates, but for a very short period of time. 1C drugs are actually different from both of them. The reason is that they are actually blocking the normal channels also. That's the reason behind. So that's why we study 1A, 1B and 1C drugs. So coming to the point or the mechanism of action of the quinidine, imipramide and procainamide. They will actually block the sodium channels. Along with sodium channels, they have a little bit activity on the potassium channels also. This is the real, you can say, a very different point of the 1A drugs from the B and C. 1A drugs are actually acting on the sodium channels, including that they are also acting on the potassium channels. So they will prolong the depolarization and also they will prolong the repolarization. So both are prolonged by the 1A drug. And coming to the point, 1B drugs like phenytoin and lidocaine, they are acting on the active and inactive for a very short period of time. So due to this shortage, they will prolong the depolarization very shortly and they will actually decrease the repolarization. So what will happen if they decrease the repolarization? In this case, they will shorten the QT interval. The distance from the Q wave of the QRS complex to the T wave is known as QT interval. We have studied these in our last videos of action potential. So by the way, coming to the point, the drugs of 1A will prolong the QT interval and the drugs of the 1B will shorten the QT interval. Though they are helping in the depolarization. They are prolonging the depolarization, both are. And 1A is prolonging the depolarization and it is also prolonging the repolarization. Well, it is not. So like this, both the drugs are helping in the depolarization. And class 1C drugs are actually acting on the sodium channels specifically, and they have no action on the potassium channel. So they will prolong the depolarization. You can observe the wave from the normal depolarization wave peak. So this slope is very, you can say, very prolonged. Now this prolonging depolarization is observed due to what reason? The reason is that these 1C drugs like flecainide and propafenone, they are actually acting on the normal channels also, due to which they will prolong the depolarization. So in short, they are all prolonging the depolarization. And coming towards the potassium channel blockers like sotalol and amiodarone, they will act on the potassium channels and they will block them, due to which what will happen? They will also prolong the repolarization. So I told you before that when depolarization and repolarizations are prolonged, so what will happen? The action potential is actually modified. So now this cell will undergo the action potential or the excitement once. Before it was, suppose if it was going thrice or 4 times, now it will just undergo the process of action potential or excitement or the contraction once. Because of what? Because of delayed depolarization and delayed repolarization. So when a cell is for excitement, after a while, so like this, what will happen? A kind of delay is observed and a kind of rest is observed. So this resting way or resting mechanism is actually helping us to reduce the arrhythmicity, or you can say they are helping us to bring the person or the patient back to the rhythmicity or normal state, rhythm. So that's a little bit from my side about the class 1 and class 3 drugs. If still there is a kind of question, you can drop that in the comment box. Inshallah, will come soon for the answers. Thank you for watching.